Good evening, everyone. We welcome you all to OrthoTV online Monday Motivation Webinar Series. Today we have a very eminent psychiatrist, Dr. Dean Creado, and my very good friend. He is actually my best friend from MBBS days. I have known him for the last 25 years, and he has tolerated me through these 25 years. He is also my personal counselor, besides being my best friend. So he is going to talk on creative coping with COVID-19 in his ways. I will hand over to our moderator, Dr. Tushar Agarwal, to start the session.
Yeah, thanks, Neeraj. And one more Monday, and here we go for our motivational Monday session. We've been having enough of academics, I guess. So this is a reliever. Let me just remind you, we've had about 5 sessions prior to this, and I'm sure this session is going to top all of them. So over to you, Dr. Dean.
Okay. Good evening. Dr. Tushar and Dr. Neeraj, thank you very much for the introduction. Neeraj, especially, thank you for troubleshooting the technical issues prior to starting. This is the first time I'm doing a Zoom presentation. So without further ado, let's get into it. Now, the topic is entitled Mind It, and it talks about creative coping not only during the pandemic, but in general during, when we face any type of stress in life. So I'll start with giving a brief outline of the topic, just to get an idea about what the current COVID-19 situation is in India and globally, followed by what impact the national lockdown in India has had on doctors. Then to look at, how people in general are coping and what coping means and what are the mechanisms of coping, followed by a very brief introduction to mindfulness, what that means in a psychological context. And then I'd like to take you through a couple of brief exercises in mindfulness and something that's called dialectics and the mind. Now, following that, we will have time for questions and a bit of an interactive session. So I'll start with talking about COVID. Now, I'm sure that most of you will have looked at this website or similar websites since the pandemic started. And being doctors, we must be reviewing this on a daily basis. So this snapshot was taken yesterday evening when I finalized my slides, and it's the MyGov portal, which was set up by the Indian government, and it gives you a daily tally of the number of COVID patients in India. Now, following this, if you look at the global situation, the website link is given there just below the title. You can see that in the scheme of things, India is actually doing pretty well given our population and the density of our population. Now, I know there are many people who have different views about why the numbers in India are so low, but let's look at the positive side, that things could have been much worse. But at the moment, Mumbai, where I live, and Dr. Neeraj lives, and Dr. Tushar lives, I think we're facing the brunt of it, along with Maharashtra. So let's talk a little bit now about the national lockdown and what sort of impact it has had on doctors. So a lot of it depends on whether you work in the public system versus a private practice. Also, whether you're a physician or a surgeon. So most physicians have been afforded some leeway with using telemedicine. Of course, when it comes to super specialties, there's no substitute for, meeting the patient face to face, for doing your own examination in person, so that you can arrive at a diagnosis. Now, I'm sure all of you have faced some sort of impact following the lockdown. And maybe we could conceptualize this as the burden or the stress of the lockdown. And there are various aspects to this type of burden or stress. So they could be financial, it could have affected your domestic routine, your leisure activities, your social relationships, and lastly, but not least, your physical and mental health. Now, if we crystallize this in terms of certain specific issues, with the pandemic, the government in India has invoked certain archaic acts, and these acts impose mandatory compliance on the general public, and they lead to a sort of loss of individuality. Now, prior to the lockdown, each of us would have been practicing in our own, eclectic way. We would have a combination of private and public. Some of us would have been attached to more than one hospital. Some of us run our own establishments. So each of us had an individual practice that suited his or her personality style. However, following the pandemic, due to certain strict rules and regulations, that individual style of practicing has to now conform to what the government says are accepted ways of carrying on your practice. Now, along with this comes a certain level of stress, a certain level of restriction, and a certain level of, let's say, distress about not being able to practice medicine the way we like to. Now, following this loss of individuality, some people who've had to shut down their clinics or their hospitals for a period of time, who've had to lay off staff or who've had staff not report for work, have faced this concept of what we call as learned helplessness. So learned helplessness is a situation where the circumstances are so overwhelming that you begin to feel that you just have to go with the flow and there's nothing you can do to really overcome it. That is one extreme, of course, but I'm talking about a wide range of reactions that people might face. Then, of course, given the fact that we are all doctors and we've all taken the Hippocratic Oath, we have an inherent need to help and treat patients. At the same time, with the recent notification in Maharashtra for mandatory COVID-19 duty by the DMER, a lot of doctors have faced anxiety and distress because on one hand, yes, it is our nature to help patients. At the same time, a lot of us have gone above and beyond, being physicians. A lot of us have specialized in surgery, orthopedic, cardiology, and some have even, done super specialties. So there's this real avoidance because we feel that we have lost our clinical skills in treating patients who are in acute respiratory distress or who have acute physical, who are acutely physically unwell. Now, I'm assuming that most of the audience today are orthopedic surgeons. And yes, by virtue of being surgeons, you do have experience, ongoing experience and practice in managing acutely unwell patients, whether they're post-surgery, pre-surgery, whether they're post-surgical complications, things like delirium, so I think, but we do have colleagues, our physician colleagues and our specialty colleagues that we can call on and refer patients to them for an opinion. Now that flexibility or those choices are limited during a lockdown and a pandemic, especially when you're on mandatory COVID duty. I'm sure people have received a lot of forward messages on WhatsApp where, and I'm not sure whether these messages are verified, but where people talk about their personal experience of working in COVID critical care units or COVID hospitals. They talk about the lack of PPE. They talk about the lack of, protocols to manage patients. They talk about feeling quite disenchanted with the whole issue. On the other hand, there are positive stories as well. So I think if we look at this impact that it has had on doctors and maybe on orthopedic surgeons in particular, there's definitely a burden that is imposed because of the pandemic and the lockdown. So we then move on to coping. Now, Napoleon Hill was somebody who said that every adversity carries with it the seed of an equivalent or greater benefit. There are many such sayings. Every dark cloud has a silver lining, and so on and so forth. It's easy to be philosophical, but when we're all in this lockdown and this pandemic together, it's not so easy to see the bright side of things. So I'll start with defining coping. So coping is defined as the dynamic process of constantly changing cognitive and behavior in an effort to master, reduce, or tolerate specific external and/or internal demands that are appraised as exceeding one's resources. In other words, anything that is stressful, your psyche or your system reacts by coping with it. Now, this definition was coined by Lazarus and Folkman in 1984, and they went on further to elaborate on two mechanisms or types of coping. Now, one type is problem focused, and the second type is emotion focused. And we'll get into a bit of that detail in a little while. Now, most people use a combination of problem focused and emotion focused coping, and it a lot depends on your personality style and your personal and social coping resources. So what does that mean? So your personal coping resources are basically your personal supports. So your family, your close friends, your religious beliefs, your cultural beliefs, and how you view things in general. Social coping resources are based on your close environment, your peer support, how people in your work group are functioning, how people in your building or your society are managing things. And it's a broader perspective, but it sort of extends on your personal coping resources. Now, the next slide goes into a theoretical model of stress and coping. So we might briefly go through it. I apologize because it's a busy slide. But if you start from the left, and the event here is the COVID pandemic and the national lockdown. Now, when it first started, we would have all done a primary appraisal of the situation. And then as time went on, we would have done a secondary appraisal. So the secondary appraisal basically looks at whether the situation is changeable or unchangeable. Now, most times when the situation is perceived as changeable, people tend to use problem-focused coping. That means a good analogy would be how orthopedic surgeons operate. You see a problem, you fix it with surgery. So that would be a way of problem-focused coping. And most problem-focused coping leads to a favorable outcome or a favorable resolution. And that leads to a lot of positive emotion. And that causes an improved self-esteem, improved morale, and overall better health. However, what happens when the appraisal of the event leads us to believe that the situation is unchangeable? So for example, we're now in lockdown 4.0. I think most of us are hoping for the curve to flatten. But till now, that has eluded us in India. So when we feel that the situation is becoming unchangeable or has become unchangeable, most people then resolve matters with emotion-focused coping. So emotion-focused coping, for example, is what we call as fatalism, where some people have turned to, a religious explanation saying, this is punishment from God, or this is punishment from nature. Because just prior to the pandemic, there was a lot of publicity about, environmental damage by industry and humanity in general. So there's a big, let's say, cohort of people out there who believe that this is nature's way of resetting the balance. So when you look at emotion-focused coping, and that leads to a sense of loss of control, more often than not, it leads to an unfavorable resolution, negative emotion, and reduced morale, reduced self-esteem, and reduced health overall. However, it's all not negative, because some of these very things that are looked upon as barriers can also be helpful, like a positive reappraisal of the situation, revising your goals, turning to spiritual beliefs, but in a positive way, believing that we will all get through this. And that leads to a degree of positive emotion. So I don't know anyone who's completely happy with the pandemic, but there are definitely a lot of people who are completely unhappy for good reason. If you look at the plight of migrant workers today in India, it breaks your heart, among other emotions. So coping is a dynamic process. Just because you've had a negative way of coping, it doesn't mean that that cannot change. And that's what the next part of the talk is going to focus on. So one of the ways that have been useful in helping people reappraise their way of coping with things is mindfulness. Now, to define mindfulness, I'll take the definition given by Professor Mark Williams, who says that mindfulness means knowing directly what is going on inside and outside ourselves, moment by moment. Awareness of this kind also helps us notice signs of stress or anxiety earlier and helps us deal with them better. Now, a lot of people think that mindfulness means meditation, but not necessarily. So mindfulness is available to us in every moment. Now, whether that is through meditation or mindful moment practices, like taking time to pause and breathe when the phone rings instead of rushing to answer it. I know that's easier said than done for busy surgeons. So this is a general statement. It may not be applicable to everyone. Now, how do you get your mindfulness going? So this slide is titled Getting Your Mindfulness On. And this was a concept put forward by a doctorate, Alan Marlatt. And it was an experiment called Surf the Urge meditation. Now, this is different to, when you talk about meditation in the Indian context, most people imagine, a holy man sitting under a tree and, meditating for days and months on end. But this is something that can be done sitting in your clinic, sitting in your car, not when you're driving, and pretty much anywhere where you have a few moments by yourself. So if you move from left to right on the slide. Now, this was initially developed to help people deal with addiction. But since then, it has had such success in treating addiction to illicit substances that they found it to be quite useful and quite good for most people to deal with any type of stress. So point one, focus on the area where you experience craving. So instead of craving, you think about the one issue that is causing stress. So the topic we're on today is the COVID pandemic and the national lockdown. So most of us will have to focus on something specific. For example, how it's affected our work, our practice. Now, the next step is to acknowledge that as a human being, you will experience stress or distress. It's not possible for you to not be affected by this. So you acknowledge how or what symptoms you feel based on the stress, whether it's a bit of anxiety, whether it's anger, whether it's frustration, whether it's sleeplessness. Different people experience a mixture of different emotions. Now, when you get stressed, you think about which part of your body is most affected. So some people notice that their muscles feel quite tense. Some people feel that their heart is racing. Some people feel that, they're getting a lot of thoughts. They can't control their thoughts. There's too many thoughts in their mind. And this uses the concept of deep breathing, where you take in a deep breath, you think about what's stressing you out, and as you release each deep breath, you release the tension. Now, this may make a bit more sense if we do a little exercise. So for that, I'm going to ask Dr. Neeraj to put out a poll question. So question 1, please, Dr. Neeraj. And if you could all look at the bottom of your screen on the OrthoTV website.
Just below the video. You can have to scroll a little below the video. So I'm just putting the poll now. So you want the first question, right?
Yes, please.
So it's live. The first question is live.
Okay. So can I see the first question or do I not see it?
You can open Chrome.
Okay. No, that's okay, as long as everyone else can see it.
Yeah.
Okay. So the first question is basically, I suppose most of you can get a piece of chocolate. Neeraj, can you get a piece of chocolate?
Yes.
Okay.
You want me to get it now?
Yes, of course.
Okay.
So I'll give you all just a minute to get up and grab a small piece of chocolate if you can.
I've got a piece of chocolate with me. Here it is.
Okay. So now, I trust most people will be able to get their hands on a piece of chocolate at home. Now, what I'd like you to do is just take a bite of half a piece of chocolate. And I just want you to take a bite and keep it on your tongue, but close your mouth.
Take a bite. Can you
Just
go again? Can you tell again?
So just take a bite of half of it and just keep it on your tongue. Close your mouth, but don't move it. Don't chew it. Don't chew it. Okay. Now, I'd like you to think about what sensations you're getting with the piece of chocolate on your tongue. So most people, depending upon the type of chocolate, it'll either be sweet or a little bit bitter if it's dark chocolate. You might get other sensations. Now, this is an important exercise that we do with people who are suffering from addiction. Now, the important thing here is you will notice that because it's chocolate, what is the most strong urge that you have? I'll tell you, it's logically, the urge is to chew the chocolate and swallow it and then take another bite. So that's the whole point. So when you're eating chocolate in a mindful way, you actually have people who describe a range of sensations as they chew the piece of chocolate before they swallow it. But for most of us, eating a piece of chocolate has become such a routine thing that you finish the first piece, then you take the next bite, so you finish that, you take the third bite, and before you know it, you finished all your chocolate. So this is something where for people who are addicts, the goal is to not swallow the chocolate and let it just melt on your tongue. And for most people, that takes between 3 to 5 minutes. It sounds silly, but when you apply to the concept of dealing with stress or dealing with addiction, it helps you to be mindful about what you're doing, which is eating a piece of chocolate. And that can apply to anything. In fact, this technique has been found to be extremely useful in people who tend to overeat or binge eat, because for them, the goal is to swallow as much as they can. But when they're mindful about what they're eating, it's surprising how much they're able to cut back on their food intake and in the process lose weight. So having completed this first exercise, I'd like to move on to the next way of coping. And this is something that has come from a merger of two different types of psychotherapy. So this one that we talked about, surfing the urge, meditation, has come from mindfulness. And the next one has come from dialectics. Now, dialectics, there are many definitions to dialectics, but basically dialectics is a psychological interpretation of any stimulus as existing on a spectrum from good to bad. So instead of looking at events as all good or all bad or black and white, dialectics looks at how things progress from being positive to being neutral to being negative, and how one event in your life can trigger all of these reactions. So I'll give you an example. Most people that I've spoken to during the lockdown, they've complained bitterly about the fact that they've lost their ability to socialize, they've lost their ability to work, they've had to sit at home the whole day, they feel quite bored. But yet, a lot of them say that their children have been extremely happy because they've been at home, they've spent quality time with their children. There's an equally large group that has felt really positive and they've gotten into or gotten focused on their health. They've gone back to exercising, gymming, doing yoga, things that they had stopped doing because of the fast pace of life. So, and there are people who have picked up old hobbies again, like singing, painting, writing poetry, and these are doctors. And if you're a member of any WhatsApp group, you'll see a lot of your doctor colleagues have posted, things that they've drawn or painted, little video clips of them dancing or playing with their kids. They've posted things about their kids. Kids have done drawings or done poetry. And this is something that is positive. It's extremely positive. 3 months ago, you might not have had the time to stop and look at what was happening, leave alone post it on your WhatsApp group. But the WhatsApp group that I'm a member of, which is our undergraduate group, we see so many of our colleagues posting things, achievements by their children, by themselves, which is removed from their role as doctors, but it's still an important facet of their personality. So this concept of dialectics in the mind, it was sort of crystallized by Gratz, Tull, and Wagner in 2005. And if you look at the diagram, there are two intersecting circles. So on the left side, you have the emotional mind, which medically we know is the limbic system. And that deals with your primitive or base reflexes or your responses to stimuli. On the extreme right, you have the reasonable mind or the rational mind, which as doctors, as surgeons, as physicians, our goal is to see a problem, diagnose it, and treat it. So that is the rational mind. where we look to find a solution to every problem that we face. And when we're doctors, we normally operate, our mind is operating on the extreme right. When we're at home, when we're dealing with friends and family, we may use a combination of emotional and reasonable mind. However, where the two circles intersect, we have a concept called the wise mind. Now, the wise mind is something that, to simplify, strikes a balance between a very emotional response and being too practical or too logical about something. So according to a lot of research, if most of us are able to be in our wise mind from moment to moment, that's when we achieve the best response to any stress. So to take this a bit further, they go on to talk about a person uses their reasonable mind when they approach a situation intellectually. They plan and take decisions based off facts. So this is mind over matter. On the extreme right, you have the emotional mind, is used when feelings control a person's thoughts and behavior. They might act impulsively with little regard for consequences. So an example of this is, when we see pictures of migrant workers jumping into trucks, onto trains, with little regard for social distancing or, wearing masks or gloves. It's there when the emotional response is so strong that it overrides all reasonable thought. But in the middle, you have what's called as the wise mind. It refers to a balance between the reasonable and emotional halves. They are able to recognize and respect their feelings while responding to them in a rational manner. Now, this is something you can practice at home in your own personal space, and you take any specific incident that has caused you stress. It could be stressful, it could be something that has made you happy, and you then look at what has been your immediate emotional response. What has been, have you had a thought about it? Have you stopped yourself and said, no, maybe I shouldn't react because if I do, these will be the consequences? And then has that influenced your overall decision? So for most of us, it's important to be able to practice this so that we start to do it in an unconscious way, but still being mindful about how we're managing stress and dealing with stressful situations. Now, I might further sort of make this an experiential learning by moving to the next question. So Dr. Neeraj, are you able to put up the next question, please?
Yes, I'll just put it up. So the next question is live.
Yes. So it's again a very simple question. If any of you have access to a cube of ice, most of us can get that quite easily from your fridge. So if you'd all like to get up and just get a piece of ice, also get a small towel or a napkin because otherwise it'll melt in a puddle.
Okay.
So I'll wait for a minute while everybody rushes to their fridges to get a piece of ice. Okay.
Yeah,
so,
I have the ice.
Very good. So now if you could just place the cube of ice in the palm of your hand, any hand, and just hold it in the palm of your
Without the
hand.
napkin?
Yes, without the napkin.
Okay.
Now, for most of us who are in Mumbai or Maharashtra, the initial feeling is it's very cool.
Yes.
It's a welcome relief from the heat that we're
But it's too
experiencing at the
cold.
moment.
It's
Now,
too cold.
now I'd like you to do is to close your fist around the cube of ice and just see for how long you can keep your fist closed.
Hardly few seconds.
Okay. So the cool ice becomes painful extremely quickly. And your immediate reaction is to open your fist and maybe even dispose of the piece of ice. So this is another concept in dialectics, which shows how on a hot day, a piece of ice, initially when you touch your skin with it, can be a welcome cooling effect. But if you leave it there, it starts to melt, becomes wet, the coldness becomes more intense. And if you close your fist around the ice and hold it tight, it can actually become quite painful. Now, when you apply this to any stressful situation, it reinforces the whole concept of wise mind. Because like the concept of emotional mind, when you try and focus too much on a problem or a stressful situation, like clenching your fist around the cube of ice, it actually makes things worse. On the other hand, if you think about things too practically, your logical reaction would be to drop the piece of ice and let it go. But there are certain situations where you cannot let things go. An example of that is the lockdown and the pandemic. We cannot escape the situation. We have to stay within the parameters of the stressful situation. And that's where something like having a napkin, placing the napkin between the piece of ice and your hand or your skin is what the wise mind is. So it allows you to feel the cooling effect of the ice without the wetness, without the pain that the cold ice may cause. And that napkin or that towel is mindfulness. That is the barrier or the buffer between stress and yourself. So I hope this has illustrated how useful mindfulness and meditation and dialectics is. It's not something that's, very fancy or it requires years of training. It just requires a basic understanding about how to take a step back and to use this technique. Of course, for most of us, we have to practice it before it becomes part of our way of coping. But I'm sure that, all of us have gone through medical school. I think if we have the right positive attitude towards this, we can all incorporate this quite successfully into our day-to-day lives. So thank you all for your patient listening. A disclaimer that this is purely voluntary at the request of my good friend, Dr. Neeraj Bijlani, and his associate, Dr. Tushar Agarwal. That's my email there if you'd like to email me with any questions. Most of these resources are from the Royal College website, the NHS website, and the part on coping is actually from my thesis. So I'll hand it over back to the moderator. Thank you.
So you will have to.
Yeah, you're muted, Dr. Tushar. You can speak. He wants to keep this on for some time. For some time, we'll keep the screen on.
Okay,
then
okay.
we'll put it on.
Yeah. So, Dean,
Yes.
that was like, I would say a very watchful and very educated sort of talk which you gave, and naturally it is coming because of your background, because prior to you we have had people who may have been in the business of helping people but not necessarily as qualified a psychiatrist as you are. Some questions do come into my mind, if it's okay with you.
Sure.
So, there is this flow theory. So it is said that you are maximally happy when you are in a state of flow. where you don't know, where there is absolute involvement, and you do not realize where the time is going. So is mindfulness same as flow, or is it separate from the flow?
So that's a very interesting question. I think, there's so many theories about happiness and how to get there that no one theory can explain everything. But if I can answer your question with another concept in mindfulness, it's derived from Buddhism. The base concept is leaves on a stream. So this was actually developed in the West, where somebody was sitting by a stream under a tree, and as it was autumn. So in autumn, what happens? The leaves from the tree fall down, they fall on the stream, and they flow along with the flow of the stream. So somebody had a bright idea saying, if we view any problem as a leaf on a stream, what does that mean? That means that with the flow of the stream, which is life or time, whichever way you take it, every problem passes away. So, but to be mindful about that is to be aware that everything has a flow to it. Now, the flow can be in any direction. So when we look at positive emotions, the flow is in a positive direction. When we focused in a negative emotion, the flow is in a negative direction. And equally, there are people who don't go either way and they just stagnate. So those are people that are unable to take a decision in a stressful situation. Because if they take something that might be positive, that's too stressful. They look at something that might be negative, that's too stressful either. This goes back to my earlier point about the approach avoidance conflict, where as doctors, we want to help people, we want to do duty during COVID-19, but the avoidance is that what if we get sick? What if we're not given PPE? What if we go home and somebody in our family gets the virus because of us? So that's the avoidance. So being in the flow or letting things or going along with the flow is useful when things are actually flowing in the right direction. But there are times when you know that things are not going in the right direction. You have to be mindful, stop, think about it, and see whether you need to alter the flow.
Another question that I have in my mind is that for some people to remain on the positive side of the thought process is easier. And for others, it is like rolling up a stone on the Egyptian pyramid. Means it's a very, very heavy task. So what's your take on that? Do you think I'm right, or it's just the perception of that person?
Okay. So again, this is a very important point you raised. As we know, everyone's personality is different. So in your own colleagues, you must be saying some people are happy-go-lucky, some people overthink, some people worry too much, some people are too obsessive, some people are control freaks. So it depends on your personality style. But regardless of your personality style, when you're faced with a problem and you overcome it either with a happy outlook or you get stressed and anxious and you push the stone up the hill, when you reach the top of the hill, everyone's happy. No matter if they got there one step at a time or they take the lift the fast way, you're still happy when you reach the top. So when you overcome the problem, regardless of your personality style, you're happy. So just because you take longer or you get more stressed doesn't mean that's wrong. It's just the way you are. That's why not everyone can win. That's why we have races. Only one person wins and one person comes last. Everyone else is in between. And that's okay. That's human life.
In this situation, Viktor Frankl's book is often quoted, and where his experiences of the concentration camp is quoted again and again. That hope is your primary calling here. I mean, you should never lose hope.
Correct.
And your they can take away everything from you, but your choice to respond, your choice to respond. So what is your uh, theory on hope?
Okay. So hope is a very strong emotion. And because Indian culture has a lot of spirituality in the background, hope or belief is ingrained in our nature, in our personality, in our upbringing. I remember most of our grandparents would tell us, no matter whether we got hurt or fell down or didn't do well in the exams, our grandparents would say, don't worry, beta, next time you'll do better. That's hope. Our parents would scold us sometimes, but our grandparents would give us hope. And for different people, they've had role models to show them what hope is about. Now, talking about Viktor Frankl, I'll slightly elaborate on that point you made. So, some of his works have been expanded by other people, which say that no matter if people take away your choices, they can never take away, no, sorry, no matter how people take away your options, they can never take away your choice. So I'll give you an example. So you go to someone's house and they offer you a glass of water, a cup of tea, or a cup of coffee. And you feel very happy because you like coffee, so you ask for a cup of coffee. Then you go to someone else's house and they only offer you a glass of water. And you say, well, I wish they'd offer me coffee because I don't want water. But you still have a choice to say, no, thank you, I don't want the water. So what that means is that even though the lockdown takes away certain options, it can never take away our choice. Whether you call that choice your freedom or your inherent dignity or whatever you call that, no one can take that away from you.
So with this, there is a question from Dr. G.S. Kulkarni. Dr. Tushar, you will ask?
No, you ask.
Okay. So Dr. G.S. Kulkarni is a very senior orthopedic surgeon. He is 80 years old and he's into full-time practice. And since last 2 months, he's been sitting at home. He is very tech savvy also. He visits, he likes to use new technology. So he's asked a question, how to maintain mindfulness or choiceless awareness for a longer time?
Okay. So that's a very good question. And for most people, it starts with practicing mindfulness for smaller or shorter issues. Be in a mindful state 100% of the time because that's part of being human. You have to be, there will be times when you will give into your emotions, and that's okay. So to try and aim for 100% mindfulness itself defeats the purpose of mindfulness. So one of the ways, if you're looking at, being at home the whole day, there are certain things that you can focus on. There's things related to your physical health, there's things related to your emotional health, interacting with your family. Now, these are all everyday things.
Dean, your voice went away.
Today, they are very useful in what we call as grounding. So grounding is a technique where you take a step back from what is happening and you go into a state of mindfulness. And so whether you use the chocolate or the ice cube method, it's a way of being aware of what is happening around you, but at the same time reflecting on it. And I think as surgeons, as physicians, as doctors, we do this very well when it comes to our practice and things like CPD or CMEs or peer groups. We do this automatically, we do this instinctively. But when it comes to the rest of our lives, it's something that we're not used to because we've never had to spend so much time doing it. But I think for most people, maybe finding something that's a hobby that they had stopped doing. Like one of my very esteemed senior psychiatrists he used to write a lot of poetry, and he had stopped doing that. And even after he retired about 7 years ago, he was still a professor emeritus. So he would still visit hospitals and do clinical work, but his poetry faded in the background. And now since the pandemic, he has restarted that. And all his poetry is so positive. It's so thought provoking. He posts it on our psychiatry group. And we all think, we knew him for so many years when he was our teacher and guide. We never knew him as a poet. But you look at him now, he could just as well have been a great Indian poet as a great Indian psychiatrist. And again, everyone has to strike that balance. So I'm not sure I can answer that question about how do you be mindful all the time or in a prolonged state, but you've got to start with small steps. To be mindful about the things that are maybe stressing you the most is the first way to manage that. Thank you.
Okay. Neeraj, we have some more time.
Yes, go ahead.
So in the same book, Viktor Frankl's book, there is a very important story here where one of his colleagues decides that there is a certain date, like 31st of March, by the time he has convinced himself World War II is going to end and they are all going to be released. And then, they come across a scrap of newspaper and they find actually the war has intensified more and it does not end. And exactly on that particular day, that gentleman passes away. So it is like he had linked his hope to that particular date, you know. So similarly, when this lockdown is happening or similar such things are getting constantly extended, so you think it can have a similar sort of impact on some of us because you are pining on the fact, you're depending on the fact that from that day onwards everything is going to come back to normal, and it just doesn't come back. So how to deal with this extension of a lockdown or an extension of uncertainty?
Correct. So Dr. Tushar, that's a very valid issue. And it goes back to the concept of dialectics. So we all hope that the lockdown ends soon. And unfortunately, in today's world, it's not enough to use the word soon. The government has to give us a date. Now, when the government sets a date, for us, that date also carries a lot of significance because for some of us, it might mean we can finally get the haircut that we've been putting off for so long. Not all of us are as lucky as Dr. Neeraj to have a haircut in the house, meet up with our friends, or it means we can reopen our clinic, or it means we can, start our practice back again, full-fledged. It means many things to many people. Now, for sure, having a deadline or an end point that keeps getting extended is extremely stressful. I think you have to look no further than Mumbai itself. I think it was after lockdown 2.0 that Bandra station had a large gathering of migrant workers who were expecting to jump on a train and go home. And what happened? They ended up being lathi charged by the police because the crowds were so vast, there was no social distancing, and it became extremely risky as a law and order situation. So similarly, there was lockdown 3.0, now there's lockdown 4.0, and I think these are unusual circumstances. No one I know is coping with this well. We all have our certain degrees of anxiety and stress about the lockdown. If you use the principles of dialectics, where the end point of the lockdown is not actually the end. If you consider the end point of the lockdown or the estimated end date of the lockdown as being in the middle of your spectrum of dialectics, that gives you a much more balanced way of viewing the situation. So in other words, simply put, you look at the lockdown ending on the 31st of May as being your best case scenario or plan A. But at the same time, if you're able to be mindful about the situation, you can also think about, what will I do if the lockdown doesn't end on the 31st of May? Am I waiting to do everything after that lockdown ends? Or are there things that I can achieve between now and the 31st? So, those are questions we need to ask ourselves. Each one's situation will be quite individualistic and quite personal. So what you may be thinking about as a goal for after the lockdown may not be something that I'm thinking of, or vice versa. So I hope that sort of gives you a bit of direction in that. It doesn't quite answer your question.
No, it does. So basically, you do create goals, you do create targets for yourself, but at the same time, you have an obstacle plan. So
Correct.
just in case there is an obstacle, so how am I going to cope up with the obstacle? And that plan should be as clear as the goals
Correct.
which you have defined for yourself.
Correct. If I had to summarize it in one word for doctors, we're all familiar with flow charts. So think of the end of the lockdown as one of the endpoints in your flow chart, and look at what your goals are. And if the lockdown ends, what do you do? If the lockdown doesn't end, what do you do then? So all of us have clinical flow charts for managing delirium, for managing surgical complications, for managing, your textbooks are full of flow charts. So that itself is a way of balancing your view.
So there is a theory which I had read on this. It's called the WOOP theory, Wish Outcome Obstacle Plan. And that comes from a book which says the negative aspects of positive thinking.
Yes. And that's a similar theory. There are many, like in business management, they talk about a SWOT analysis, SWOT. So there's different people coin different terms for that.
Yeah. And recently I heard something very interesting by Simon Sinek, who has written this famous book, Start With Why. And he says is that the difference between positive thinking and being optimist is positive thinking is denying that your present is screwed up. Means it is screwed up. You are in a difficult situation right now. But being optimist means the future is definitely going to be very bright.
Correct.
So we should not have forcible positive thinking, but we should not lose our optimism. That is what he said in his talk.
Yeah. And I think that's a very good point. Again, how you perceive that or how you're able to implement that depends on your personality style. If you're somebody who's an optimist by nature, that will be very easy for you. But if you're somebody who's a pessimist by nature, it's going to be quite challenging.
It is very challenging. But you mentioned the term learned helplessness. So the same Martin Seligman has the book called Learned Optimism. Correct. So he says the same way we learn helplessness, maybe this is a great exercise to learn optimism for us.
True.
We can use exercise to learn optimism.
True.
Yeah. Okay. Neeraj, anything else that you need to ask?
No, I think I have answered all my queries, and plus he is my personal counselor, so I keep on asking him the whole lockdown.
Yeah, he's amazing. It's a blessing to know him.
All right.
It was a great talk. Yeah.
Thank you very much.
So on behalf of OrthoTV and Monday Motivation, we thank Dr. Dean Creado to take out his precious time for us. This webinar will be available for the next full year for all of you to see. Those who have missed it out, I would say that you should just go and rewind the whole webinar and see it again. So see you everyone, and good night to all of you in India.
Good night. And there was no precious time. So thank you again.
Everybody's free nowadays.
And
during the lockdown.